Hello everyone, I hope you're all well. The title of this video is Recovery Sabotage, and I'll get into what I'm talking about there in a minute, and I'm also going to talk a little bit about the clinic where I'm with that. But before I do that, I got an alert from YouTube telling me that I've reached 500 subscribers. It's a little bit over that now, I think. And I just want to say, when I put my first video out there, I had no real thought that this was going to take off like it has. I had no real inclination that I would be putting out videos regularly like this. It was going to be 1 or 2, 3 videos at the most. But it seems to have taken off, and that's thanks to all of you guys out there for subscribing and letting me know that my videos are helpful and they do give people some hope. Even when I'm having my own bad times, it seems that people can relate to this. I guess in a way that it lets people know they're not alone and that we all have ups and downs, including myself. And it still seems that people are finding my videos helpful. So while that is still the case, and it still seems that I'm getting, positive feedback for the videos that I put out there, I will continue to make them. So I just want to say thank you everybody for making my channel what it is. So thank you. Okay, so people have been getting in touch with me because in my last video I did say that I'd not been good with my own tinnitus. It hadn't been good. Well, today I'm much better, and my tinnitus is back down to a level 1 or 2 where I like to be, and pretty much I'm not hearing my tinnitus again. I'm not hearing my tinnitus during the day again, and it's a very lovely place to be again. I'm much better. Now this brings me on to the title of this video, Recovery Sabotage. Having said that I'm much better today, which I am, I would have made this video earlier than today, as I got my tinnitus to back right off shortly after I made the last video, and I was in a good place, but unfortunately, while I was at work having my tea break, an alarm decided to go off right next to my head. And to make matters worse, this alarm was identical in tone to what I hear as my tinnitus, except for it was like, I don't know, a crazy volume, because it's an alarm and it fills the entire warehouse where I work. So it killed my ears. So having got to a better place using the methods that I'll talk about in a minute, this alarm went off and took me right back down to a level 4 or 5. And what I want to say is, also they couldn't turn this damn thing off, so I had to work in areas where I could still hear this damn alarm going off, and it triggered my tinnitus into overload. And as I say, it went back to 4 or 5, and so that was terrific. Now, in the end, I had to tell my boss that I wasn't going to come into work till they'd fix this alarm. Without going into too much detail, I think it can still be a real issue when and problem when other people, such as my health and safety department, don't understand this condition and wonder why having an alarm stuck on is such an issue when others find it okay with the situation. Even when you've explained or tried to explain it to people, it was kind of a case of, well, other people are okay with the alarm going off, they're working in other parts of the warehouse, is it really this big of a deal? And is it simply that they don't understand, or is it simply that they just don't care? Until you don't go into work, which is what ended up happening. So I took some time off. So after that recovery sabotage at work, oh, and funnily enough, I did get a text from my immediate boss, he is understanding. He does understand what I'm going through. It's the rest of them that don't. I did get a text off him saying, you know, I'd taken this day off work, and funnily enough, they were getting an engineer in the next day to fix this alarm. So that's strange. As I said, I'm at the start of this video, I am now back to a level 1 or 2, and I'm not hearing my tinnitus during the day, although it's there, but I'm not hearing it. At night it's noticeable, but not bad. And now I still get people. I've been in touch with a couple of people through posts and emails saying what I've just said there, and still people are asking, how did I get it back down again? What do I do? What methods do I use? And it's the same as ever. This is basically what I'm going to say now is really for people that are new to my channel, that haven't heard me say this before. I know this sounds oh so simple, but the methods that help me and allow me to get my tinnitus to back off into the background are all those to do with calming the nervous system. Now, firstly, to not overthink situations. Stop worrying about life stuff. Stop worrying about life and stuff that I can't do anything about, so what's the point in worrying about it? And also hands-on therapy such as massage in certain areas that have a real effect on my tinnitus, particularly at the back of the skull, where the spine meets the skull. And my partner's getting very adept at this now. She gives me like a pseudo cranial therapy, and I've replied to a few new subscribers about this, the craniotherapy. My partner Amanda now, she knows what works for me, and when she gives me a massage, it's at certain points at the back of the skull, and this really is pleasurable, and it does have the effect of bringing my tinnitus down. And also the meditations, the audio files that I've sent to a few of you. And also I went back to practicing my Tai Chi, which I neglected for a long time. I've gone back to that. That's really helped. And going, a big help for me, and I do advocate this strongly, a big help for me is training at the gym. I've got my pro bodybuilder sister training me and helping me with my diet, and all of that has been a huge factor and always helps and is helping me with my tinnitus. Overall though, it really is as simple as it sounds, a case of calming down the overthinking, overactive head that I am. So anyway, I'm good. I'm really good at the moment. I'm not hearing it, and I'm really good. So thank you for all that wish me well since my last video. Okay, so now on to this clinic and where I am with that. Okay, since my last video. So I contacted the clinic with a view to a possible appointment, but I wanted to ask some questions about their treatments and costs, etc., before I committed myself to anything. And the first person I spoke to, I asked about neuromodulation and other treatments they offer and the cost of it, and I wanted to know what was, as per the video, the BBC video with Tony Blackburn, I wanted to know about cost, and it was said, and I quote from the video, that you can go on a trial period, and if the treatment doesn't work, you get your money back. And the woman I was talking to said she could not answer that, but someone would get back to me to answer these questions fully. So, okay. So an hour went by and I got a phone call, and I spoke to another consultant, and I explained briefly where I was with my tinnitus and what I found has helped me. And the consultant then went through a number of treatments that she thought would be of help for my tinnitus, not having had an actual consultation yet, but from what I've described, she went through a number of treatments that she thought would maybe be of help to me. Now, the first one that she spoke about was, and I'm not going to go through them all, I'm just going to go through the ones that she thought would have been relevant for me. Now, the first one that she spoke to me about was the tinnitus desensitization therapy. Now, this is a treatment for patients who suffer with invasive tinnitus, right? And it says, she basically said, this is like a device that you put on your head and so on, and she spoke about it. And when I looked into it, because I looked it up on her website, etc., on the website, and this really is just a sound generator. That's all this is. It's just a sound generator, albeit that they calibrate it to your own tinnitus. They probably do go quite involved with the calibration of it. I'm sure they do. I'm going to try and be balanced about what I think of this clinic so far. I haven't seen them yet, so I am going to try and remain balanced, but I'm just going to give you my perspective on it as I see it at the moment and my opinion at this time. So this is just, like I always try and put across, this is just my opinion, okay, at this time. Right, so when I looked into this tinnitus desensitization therapy, what this actually is, by what I can see, everything I see about it, is just a sound generator. And it doesn't seem to be any different, although they say they can offer you different types from different companies. It doesn't seem to be anything different with this particular therapy they're offering to what I had from the NHS hospital. It is a sound generator, and the cost of that is £1,675, and I don't know why, and after speaking to her I still don't know why it's so expensive. I gather that you do have consultations with them, but it's not like the neuromodulation one, from what I can tell, if I got it right, and it's £1,675. So I said to her, well, no, I've tried that, I've tried a sound generator, and that did nothing for me, so I'm not really interested in that. So then she said to me about a new, relatively new approach they've got, which is called the new Lenovo system for tinnitus. Now this one, you wear this one while you're asleep, so you don't wear it during the day. So you wear this one while you're asleep, and she said this is very, very good. And also I looked this up on their website, and it says the theoretical clinical evidence behind the system is growing all the time. Okay, there are key papers that they've got on their website, and they can provide copies of these if you wish to read them. So they're saying that this one has apparently it's got a pretty good proven record, and that one is £4,000. So again, very, very expensive. And then we got on to acoustic neuromodulation, which is what I was really interested in. And we spoke about neuromodulation, and I remembered to ask her that I'd listened to a video with Tony Blackburn and one of the clinic's representatives, and that I quoted what this guy had said, saying that you don't have to worry about spending £5,000 and it not working, because they offer a trial period, a suitability criteria and a trial period, and if it doesn't work you basically get your money back. And I said to her, so is this you offer this trial period? And no, they don't. They don't offer a trial period. So I said, well, you know, this video says that you do, but they don't. what they do, and I suppose you could call this a trial period, however, is the cost of neuromodulation is approximately £4,495. And when I did ask about the trial period, she said, no, we don't offer a trial period, but what we do, and I'm sure she said it was 8 weeks, within an 8-week period. I may have got that wrong, but I'm sure it was 8 weeks. If you find, you the patient, if you find that it isn't working for you and you don't think you're getting anything from this, they will offer a 60% off the cost. Now at that price, that still means, to say you had it for like, I don't know, a couple of, less than 8 weeks, and you think to yourself, right, it's not working, this is doing nothing for me, and I don't want to spend £5,000 on it. Even though you get 60% off, you're still paying, worked out about 1,700 and something pound. So it's still not going to be cheap, is it? Is that worth taking that risk? I don't know. Depends how bad your tinnitus is. Some people are cautious. Some tinnitus people out there are going to be so, I know, because I've been there. There was a time when I would have forked out any amount of money with any sort of hope. If there was just a glimmer of hope when I first had tinnitus, I would have forked out, £10,000 without even thinking about it. So I know how some people can feel, because I've been there. But now that I've got myself to a place where I can get my tinnitus very, very low and I'm living with it, I can look at things a bit more sensibly and logically. So I spoke to her about this, and really all of these treatments, I said to her, how do these work, etc., and she referred me to a part on the website, and this makes sense. All of these treatments, the way they work, in the long-term treatments, affect the brain's natural synaptic plasticity, disrupting the cycle over and over again, which weakens the pathologically enhanced connections in the highly synchronous, hyperactive nerve cell assembly. So in other words, the neurons firing, all over the place. As the connections between the nerve cells grow weaker, they are less able to synchronize. This means pathologically synchronous cells unlearn synchronicity, and as a result, how to produce the tinnitus tone. It is therefore the natural synaptic plasticity of the brain itself that supports the sustainable success of treatments using acoustic neuromodulation. So from what I took from that, and what she said to me was, it's really interrupting the connections in the brain that produce the sound till the brain unlearns to focus and to lock into the sound that we hear as our tinnitus. That's my interpretation of it. That's what I got from this. So okay, so that made sense. And after this, she went on to say to me that they also offer, she referred me back to the website, they also offer sleep counselling and relaxation training, behavioural therapy, and all of these other methods for reducing negative emotional reactions to tinnitus, anxiety, behavioural therapy, relaxation, cognitive restructuring of thought, and examples of how to improve your feelings about your tinnitus. So a lot of it that she spoke to me about, the other therapies aside from these devices, were things that myself, Julian, Gray, are putting out there and have been putting out there for a while, all about natural methods of just bringing and calming down your nervous system and your mind. And you don't have to pay for that. you can find methods and ways that you can do that yourself without paying a lot of money, as I have been doing, and that you can do. You may need some help and guidance with that, but I think if you go to someone like Julian or a cranial therapist, you can end up with something, you know, that's really going to help you without paying out thousands of pounds. So I also asked, while I had her on the phone, I also asked, is there anyone, because she was saying about this neuromodulation, how terrific it is, and the Lenovo, the sleep one as well. I also asked if there was anyone she could put me in touch with directly that have found any of these devices to really help them, as there seems to be there's a lot of testimonials on their website from people that are saying it's fantastic, it's helped me, it's stopped my tinnitus, it's reduced it to a level where I'm, you know, not even hearing it. And she said to me, unfortunately, no, they don't offer this, as it comes down to a data protection. Okay, which I find a little odd, as there are so many testimonials that they put up on their website, but okay. Now, the cost of a consultation just in itself is £200. So, did I make an appointment? At this time, no, I haven't. At this point in time, I don't have £3,000 to £5,000 to spend on something that I'm not convinced will be of any help to me. If there was the trial period, whereby if it didn't work, you'd get your money back, I mean, that's a no-brainer. Of course you're going to try it, and I would. But there isn't. They don't offer a trial period. And I don't think within that space of 8 weeks, which she said to me, I don't think that would be long enough for you to know whether it was going to work or not. So after 8 weeks, you're locked into paying this £5,000. That's just the way I see it. But more of a reason why I haven't booked an actual appointment to see them yet, more of a reason, is for me personally, just speaking for myself, as many of you know, I am able, as I have recently done after having this alarm go off right next to my head and pushing my tinnitus up to a level 4 or 5, luckily for me, I know how to get my tinnitus to back right down again, and the methods that work for me. So for me, as I'm able to get my tinnitus to a place where I am now, where it's in the background and it's like at a level 1, and I'm not really hearing it during the day, I don't really see the need to go and spend a couple of £1,000 in the hope that something's going to make this better, because for me, I don't think it's something I'm going to pursue at the moment. However, I'm not writing off the treatment offered at this clinic. I'm still intending to visit this place, this clinic, but it won't be till after Christmas, because I'd like a full consultation. I'd like to hear more from them, for curiosity if nothing else. If I'm more convinced at the time with what they can offer me, and hopefully I'll be in a better place financially as well, I may try one of their treatments. I may do. But at the moment, it's not something I'm really, pushing to pursue. But I will visit them at one point. I will have a proper consultation and see what they have to say. Now, having said all that, and my rather cynical, sceptical view of what they're offering, I'm still not convinced by any of it. I did have a post from somebody else, Sassoon, and he seems to, he had an experience with this clinic, and from what he's written, he seemed to have a positive experience with them. So I need to balance this up a little bit, so I'm going to read what he posted to me, and you can make of it what you will. And he says, "Hi Adrian, in November 17th, I was suddenly struck with tinnitus, which became quite bad. I ended up drinking to suppress the noise. which it did temporarily, but of course it always came back. I ended up in hospital to do with drink, but I haven't drank now for about 7 months. Roughly in May this year, I went to the clinic and got 2 sound noise generators, and for about the next 3 months I had periods of relative peace. Tinnitus is still there, but quite a bit lower. It's not intrusive, not that awful piercing sound. I could then go to the gym, read a book, watch a film without the noise ruining my life. I had ongoing support from the clinic and some cognitive therapy sessions, which were included in the main price. I had a spike after this 3-month period, and they adjusted the tone in the devices. I'm now at a stage where I have some days quite peaceful, then the noise will come back. But I'm grateful for those days of relative peace. Before these devices, I never had any peaceful days. If recovery is happening, and I hope it is, it doesn't come in a smooth curve of tinnitus declining as I may have expected. Rather 2 or 3 days of tinnitus than a couple of days of peace. They did explain at the clinic that getting better is not a smooth upward curve, but rather a jagged line of peace when it comes back, and hopefully some peace again. All I know is that I do get days of relative peace now, which I never had before. Then he's written, does it work? ? That's the big question. I think something is happening, and I'm on the road to getting better. All I can say is what they have to say. I've tried to relax a lot more. Taking yours and Julian's advice, I'm trying to train in the gym, as you have said, with more focus within rather than getting angry or hyped up. Also, I started studying Tai Chi in the past month for a number of years. Right, okay. So I'm doing that also. On my fridge, I have some stickers reminding me of the positive, peaceful days. Julian recommended me to do this, so when I have a bad day I can reinforce the message of hope. Right, so he found these devices helpful, so there's a different opinion there, although he doesn't actually say what ones they were. He says sound generators, and that this helped him. I would still say with the sound generators, my opinion of those, if they're anything like the one that I had, is that really they are just putting a different sound over the top of the one that you're hearing as your tinnitus. And actually that is something that the consultant said to me on the phone, that the sound generators, the idea behind them, in agreement with the NHS doctor that I saw, is that you end up habituating to the sound of the sound generators putting out, which is a more pleasurable noise. You habituate to that rather than listening to the tinnitus tone. Well, I still don't really see the point of that, habituating to another noise. I don't see the point. I can see the point if your tinnitus is awful and you just want to shroud it and listen to something more pleasurable than that, like we do with white noise. I understand that, but as a treatment, I don't think that's the whole idea behind that. I don't think that's a good idea as a treatment, just to habituate to a different noise. I'm looking for something that's going to reduce the actual tinnitus sound itself, which they say the other devices can do. The Lenovo device that you wear in the evening and the Neuromodulation, they say that it does reduce the sound of your tinnitus. So that is what I would be looking for. But at the moment, I'm still not convinced. There's no strong evidence coming my way, no one-on-one contact with anyone. Still no one has come forward to me to say, yeah, this neuromodulation pretty much cured my tinnitus for me. No one has come forward to say that yet. So I'm sceptical. I'm open-minded, but I'm sceptical still. What else? Also, Sassoon says that he's practicing the methods that myself and Julian speak about, going to the gym, Tai Chi, and so on. And they are working for him, so I would continue with those, Sassoon, because they are working, and I can speak from experience. These methods can and do work for people. So at this point in time, for me personally, I'm not in the mind to go and spend a couple of grand on something that I don't think at this point in time with my own tinnitus that I really need to. But I will visit the clinic. Like I say, if for nothing else than curiosity, and financially, if I do have this kind of money that I can just spend without worrying too much about it, maybe I will try one of their devices. If it does work, fantastic. But at this time, it's not something that I'm going to. It's not something that I'm going to go and commit myself right at this time. So anyway, again, thank you everybody for your well wishes. I am, as I say, back down to a level 1 or 2 self. I'm not hearing my tinnitus during the day, and it's a lovely place to be again, and I just need to stay here, and hopefully without any alarms going off right next to my head, because as I've said many times, life can just throw stuff at you sometimes and nothing you can do about it, and having an alarm explode next to your ear when you have tinnitus, it is not beneficial. It is not beneficial, and so certain things we just have no control over. But I know how to get myself back to where I need to be, where I am, and it's lovely to be there, and I just need to stay there again. Okay, so thank you everybody, and I will see you all again soon. Bye bye.